welcome to the SVG-TV News for Tuesday, July 27th. I'm Khalil Cato with the details. Today, grade 6 students across St. Vincent and the Grenadines turned up at 41 centers for the first of the two-day Caribbean Primary Exit Assessment, or CPEA. In capital Kingstown, students, parents and teachers showed up outside some of the examination centers as early as 7:30. As we hear in this report, Larissa Pugsley-Kidd tells us that the COVID-19 protocols were in full effect at the various examination centers.
After months of delay due to the COVID-19 pandemic and most recently the eruption of Lasso for a volcano, 1,895 grade 6 students across St. Vincent and the Grenadines are sitting the Caribbean Primary Exit Assessment, or CPEA, under challenging times. The subjects written today were mathematics and social studies. 138 grade 6 students of the Kingstown Preparatory School are writing the regional exam at the girls' high school.
I am really nervous for this exam because I'm not really good at maths, so I don't know if I'm going to be good at maths today.
I expect to pass all of them in hopefully the high 80s.
Not nervous. I just want this exam to be over with. I've been studying a lot, so as long as I get this exam done and I do my best, I'm fine.
I think I'm prepared a lot because I've been studying a lot, and I just think I'm prepared for the exam today.
I'm nervous, scared, kind of scared.
Yeah.
Why? Because you're just going against all the schools in St. Vincent.
The Kingstown Prep School is still being used as a shelter for volcano-affected persons from the red zone. Grade 6 teacher Suzette Holder said they did the best to prepare the students for the exam despite the challenges.
So I think that they are very well prepared. Unfortunately, our students last year in grade 5, they did not get to go back in for face-to-face class. And this year, we know what happened with the situation with COVID and the eruption of the volcano. And also coming to the end with four days were taken from them because the hub was used for the diagnostic test. But we did the best that we could have done with them. We had the support of our parents. Our children, they're really exhausted, yes, but we are optimistic and hoping for the best as always.
61 students from the Kingstown Anglican School are also sitting the exam at the girls' high school.
Patrice Dick, and I'm from the Kingstown Anglican School. I think my students were well prepared. It's up to them now to do their best. That's all I'm expecting of them. Oh, sometimes it was challenging, but at times we had fun, and I think they are prepared.
Parents also flocked to various examination centers to lend support to the children. Some of the students wore long pants, which is acceptable to protect against the Egypti mosquito that spreads the dengue fever. COVID-19 protocols were also in full effect, with temperature checks and sanitization stations installed for students to sanitize their hands. Tomorrow, Wednesday, July 28th, the students will return to their respective examination centers to sit language arts and science. The CPEA results are expected to be released by CXC next month, which would allow for sufficient time for the Ministry of Education to conduct its secondary placement exercise for the new academic year. The Ministry of Education is hoping to start the new academic year here in SVG in October. For SVG-TV News, Larissa Pugsley-Kidd.
Parents outside the examination centers were in full support of their children, whom they said have been through a lot over the past year, but they were confident that they'll do their best.
For me, I'm feeling very anxious, right? And I believe I feel anxious more than my child because last night is like, between sleep and wake, it's like you're wondering if you as a parent, you would have covered everything, if you have done, the best with them. And it's like, I just had to tell myself, you know what? To the year, it was a struggle, right? But you put God first in everything. To the year, it was a struggle. They would have done the best. The teacher would have done a great job with them. And I know that they're ready.
I feel happy about them and wish them all the best. Wish him all the best in his exam, and God will bless him.
I'm feeling very confident for my daughter, Haley Gardner. She wasn't doing well, but as the time go, she was doing really good. So I'm feeling very confident about her.
While it was observed that there were more mothers outside the examination centers, the fathers who were present were equally supportive of their child or children.
I feel very good. I'm very proud of my son going there today. You get the opportunity to do something that that I didn't have to do in my time coming up. So I'm glad. I'm proud of him.
Is this your first, second?
Yeah, my first son. So the first time here. The parents are here ensure that the kids be prepared and be ready for today. Up to last night I've been up with my son until about 10, 11 o'clock. We reviewing what they're supposed to be doing today. So to get him prepared, get him his mindset to what he was supposed to be doing today.
But the only thing we have a little bit of delay concerning like teachers coming out and stuff like that. But I know the children them will do the best. And I hope I wish them all the best for the year, and I hope that they will hit some top schools. Because they've been doing that all the year round, all the years gone by also, but they've never been recognized. So I hope that they will be recognized for this year.
With vaccine hesitancy still high among Vincentians, Prime Minister Dr. Ralph Gonsalves said this could lead to a pandemic of the unvaccinated. The Prime Minister, who was on radio yesterday, said the majority of people who are now contracting the COVID-19 virus is in the unvaccinated population.
99.5% of the unvaccinated are open to get COVID. That is what the real data shows. What we have now, since we have the vaccine, is a pandemic of the unvaccinated. It's a pandemic of the unvaccinated. People must hear this responsible voice, which is coming to you. And I want to thank Sinclair Leacock on Saturday for taking on some of the vaccine hesitants and the anti-vaxxers, even inside of his own political outfit.
The COVID-19 vaccines available in SVG are the Oxford AstraZeneca and the Russian Sputnik V vaccines. Only recently, Vincentians were told that unvaccinated persons have to pay $26 EC to do a COVID-19 test. The Prime Minister was asked about provisions made for those who are willing to take the vaccine but cannot do so because of circumstances like pregnant women. In this regard, the PM said the COVID-19 task force will have to review the payment options and make exceptions.
Well, that is a medical question. As I understand what the Chief Medical Officer says, well, you take the test, even though you may be asymptomatic, because it's important for you and the child you're carrying. And the doctors will decide, in the condition in which a particular patient is, whether they should wait to take the vaccine. Well, that number wouldn't be a big number, so I don't see any problem with the medical authorities in those circumstances saying, okay. You know what I mean? That's a small number, relatively speaking now.
Right.
Yes.
So how would the person go about this then?
Well, I will talk to the CMO on this question you raised, Johnny. This is why the importance of these meetings, this conversation.
Yes.
That's a practical question I could ask about.
And one new positive COVID-19 case was reported from 319 samples processed on Saturday, July 24th, resulting in a positivity rate of 0.3%. The health authorities say the new case is linked to an emergency shelter. No new positive cases were reported from 93 samples processed on Sunday, July 25th. 3 new recoveries were noted over the reporting period. 66 cases are currently active and 12 persons with COVID-19 have died. 2,280 cases of COVID-19 and 2,202 recoveries have been recorded in SVG since March 2020. The health authorities say persons who persist in incorrect or no mask use, remain unvaccinated, and participate in mass gatherings will continue to be at risk for being infected and spreading the COVID-19 virus, and that to reduce the spread of the virus in the country, compliance with the protocols, including the effective use of masks, physical distancing, and the evidence-based recommendations to be vaccinated with the available vaccines is strongly recommended. As the island gets ready to welcome its first cruise ships in over a year, the Ministry of Tourism, in conjunction with the Ministry of Health, has finalized draft COVID-19 protocols for cruise lines coming to our shores in order to kickstart a safe and early cruise season. At a news conference today, Minister of Tourism Carlos James outlined the decisions taken in conjunction with the other ministries of tourism across the Eastern Caribbean and the cruise lines, which will see crew and passengers coming to these shores being fully vaccinated, among other requirements.
Passengers who embark on a ship, and let's use Barbados as an example as the home port. Now, they are expected to have a COVID-19 PCR test 72 hours before boarding the vessel. And also they're expected to have not just a negative PCR test, but also to be fully vaccinated 2 weeks prior to embarking on the vessel. This is something that all of these stakeholders, the cruise industry, the government of Barbados, the Minister of Tourism, and Lisa Cummins, she's doing tremendous work in Barbados. We have been in regular dialogue and been having this conversation with other ministers of tourism in the OECS in the sub-region as to how do we navigate around this whole issue of COVID-19 and the resumption of all the cruise. And one of the decisions that we all agreed on is that we will have the resumption of cruise, but in a very controlled way, whereby the passengers and crew of the respective cruise lines, when they come to our destinations, are expected to be fully vaccinated.
According to Minister James, under these protocols, a bubble concept has been created to safeguard cruise passengers, stakeholders, and the Vincentian public by limiting exposure between the various parties. The bubble, which will apply across the various destinations, will see passengers interacting with only vaccinated personnel and to and from pre-approved sites. Minister James said any breach of this bubble will result in fines for the tour operators, taxi drivers, and the passengers.
Take, for instance, the vessel arrives at Port Kingston. Everyone on the cruise terminal is expected to be a part of the bubble. Passengers would no longer be able to disembark and walk around freely into Kingston or any other location which is not sanctioned or approved by the Ministry of Tourism in conjunction with the COVID-19 task force. Essentially, we will identify the sites in which the passengers are able to visit, and we will do this in a very controlled way. And the reason for taking this approach, as I said earlier, is to prevent the mixing of the population in terms of having passengers going into the general population and not being able to properly contain in the event of any serious measures or breach in terms of our COVID protocols as it relates to the COVID-19 pandemic. So we have to be able to control and separate the passengers when they do come.
The minister discussed what the bubble will mean for stakeholders on the ground, highlighting that anyone who is entering at the various ports must be vaccinated. He noted that taxi drivers will be given 2 stamps, their regular tourism-approved licensing stamp and a health-safe operator stamp. They will also be required to have with them at all times their vaccination cards. The operators will, however, only be allowed to carry 75% of their regular passenger capacity. Minister James said while cruise passengers will no longer roam the streets of Kingstown, persons who ply their trade may be moved to an approved site in order to meet their target audience and where they can continue to earn $1, despite the changes to the sector's operations. He, however, stressed that vendors must be fully vaccinated in order to be in the bubble.
I want to make this very clear, and I've said it to all of the agents of the vessels and to the Ministry of Tourism and the Tourism Authority. I want as much vendors to be a part of the bubble. So if we're going into the Botanic Gardens and they're not allowed to walk around, which is the passengers in Kingston, I want as much vendors to go into the Botanic Gardens. The entertainers also, the pan men and the steel orchestra groupings and so on, to go into the Botanic Gardens so that they can then make a living and ply their trade within the bubble. The tour guides, it's the same position. You're not allowed to take them around Kingston, but you can take them to Fort Charlotte, or you can take them to another location, Black Point Tunnel. And the very reason for having an inclusive approach is that it doesn't make sense we have a resumption of cruise and the stakeholders who I value so much, the artisans, the vendors, the entertainers, the taxi operators, are not able to make a living or a dollar.
Barring any complications, SVG is expected to welcome its first cruise line of the season, the Seabourn Odyssey, at Port Elizabeth Beckway next Saturday, August 7th. The Tourism and Culture Minister detailed the ship's plans at today's news conference.
Next Saturday, August the 7th, we are expected to see Seabourn Odyssey, our very first vessel to this destination, St. Vincent and the Grenadines. Very first cruise call for the 2021-2022 season will take place more than likely next Saturday, August the 7th. The schedule for Seabourn, they are likely to arrive in Port Elizabeth. That's the port which they have identified they have an interest in making their call on. I understand that they're hoping to have a continuous period of calls at least every other Saturday, which is at least 2 Saturdays per month from August until October of 2021.
Thus far, SVG has registered some 224 cruise ship calls for the season, with more expected, withstanding any COVID-19 related issues in the local and international markets. Minister James said the promising cruise season is one to celebrate, given the challenges presented by the COVID-19 pandemic, followed by the La Soufrière eruption.
Approximately so far 224 calls to our destination this cruise season. This is, of course, the early stages, and we're expecting to see more calls being added to St. Vincent and the Grenadines as a destination. We anticipate additional calls, and of course, this is subject to, as I stated very earlier, the caveat as it relates to what transpires with COVID-19, both locally and internationally. Out of those 224 calls so far, which can increase, we have 14 inaugural calls, meaning that these are vessels coming to St. Vincent and the Grenadines for the very first time.
According to Minister James, 19 of the 224 cruise lines expected here are expected to dock on the same day, which presents a unique challenge.
Out of the 224 calls, we have roughly 19 of the vessels arriving on the same day. Same day calls meaning that you may very well have 1 or 2 vessels in port at the same time simultaneously. Of course, this is going to be a humongous challenge for us as an industry as to how we navigate in terms of getting persons off of the vessels in a safe manner, getting them through the various sites which are approved, tourism approved, and getting them back onto the vessels. And I know that with confidence that the team at the Ministry of Tourism, the Tourism Authority, and all of our agents will work together, the COVID-19 task force, to ensure that this is done in a very successful and smooth way. As it relates to Port Kingston, we will see roughly 105 calls to Port Kingston, 59 calls to Port Elizabeth, 35 calls to Mairo, 12 calls to the Tobago Keys, 11 to Union Island, and 2 to Canoan.
2 Vincentian women and a minor who entered Grenada illegally are now on the island's deportation listing. This follows a similar occurrence about 6 weeks ago. We hear more in this report from GBN Television.
3 Vincentian women were ordered to leave Grenada after illegally entering the island. They were detained by officers attached to the Western Division. 21-year-old Kesani Bob, 20-year-old Love Collis, and a minor were brought before the St. George's Magistrate Court on Monday. Head of the Community Relations Department, Superintendent Vanny Kerwin, provided an update this morning.
They went to court this morning. These are the 3 Vincentians who entered the country illegally last week. They were taken to court this morning and they were ordered to be deported back to St. Vincent. So yes, to answer your question, they should have been tested for COVID-19. They are currently in police custody waiting deportation arrangement, after which they would be sent back to their homeland.
This is the second time within 8 weeks that police have arrested and charged Vincentian nationals for entering Grenada illegally. The uptick in illegal entry among Vincentians has been linked to the recent volcanic activity on the island. Hundreds have been displaced by the La Sofria volcano, which exploded in the month of April.
A food and nutrition, or FAN, project is being implemented here in St. Vincent and the Grenadines. It is a 4-year project aimed at improving household nutrition, security and public health in 3 CARICOM member states, namely Jamaica, St. Kitts and Nevis and St. Vincent and the Grenadines. The project will leverage findings from the prior Farm to Fork project, creating pathways for agriculture and schools to improve school meals and the diets of children. Speaking recently on NBC's Face-to-Face program, one of the project managers, Dr. Wanisha Jones, said the project is a follow-up to the Port of Spain evaluation project, which seeks to implement policies and programs to confront the rising incidences of non-communicable diseases, or NCDs, in the Caribbean.
And it's a 4-year project funded by the International Development Research Center, and it's focused in 3 CARICOM countries: Jamaica, St. Kitts and Nevis, and of course, St. Vincent and the Grenadines. And it's a multi-sectoral initiative that links ministries of agriculture, ministries of health, ministries of education, as well as regional and national institutions and the region's private sector. And its specific objectives over these 4 years are to basically describe non-communicable disease risk, or NCD risks, what factors influence their food sources and dietary patterns of these populations, understanding how local food systems determine our dietary patterns, to develop interventions that leverage local food systems to increase healthy eating, and also basically throughout all of this to work very closely with the public, private, and civil society partners to make sure that this is a sustainable process.
The other project manager, Catherine Brown, said they engaged stakeholders to understand how local food systems currently determine dietary patterns in order to increase healthy eating and sustainable rural livelihoods. Brown said non-communicable diseases are the leading causes of death. That should be the leading cause of death in the region, and the FAN project is one approach to address this very worrying issue, noting that 1 in every 4 adults in SVG is obese.
So the NCD, or non-communicable disease epidemic, is disproportionately high in the Caribbean. So in the Americas, that's North America, Central, South, and the Caribbean, approximately 39% of non-communicable disease deaths occur in people younger than 70 years old. And this shouldn't be happening. And also there's a gender disparity. So women tend to be sicker for longer with these diseases, while men tend to die sooner from NCDs. And in the Caribbean specifically, NCDs are the leading cause of death and disability. So 76% of the total deaths were due to NCDs in 2016. And cardiovascular diseases, cancers, diabetes are the leading causes of death due to NCDs. And as I said, many of these persons die in the prime of their lives. That's before they turn 70. And so yeah, this is really a problem. And on top of all of that too, is that the main countries are Guyana.
16 persons over the age of 18 will be trained in coral reef restoration at the Richmond Vale Academy. In a telephone interview, Director of the Academy, Stina Herberg, said the training for the coral reef gardeners is part of a marine project, that should be a marine conservation program being undertaken by the Academy, Sustainable Grenadines, and Myro Explorers, which is being funded by the Caribbean Biodiversity Fund. Herberg said the 8 males and 8 females who will receive training in coral reef gardening and diving are expected to become stewards of the marine environment.
Do the training in coral restoration, we are going to use the PODI or the PSS certified diving manuals, but really what's interesting here is we are going to use models from the CARICOM approved vocational qualifications in coral restoration, and we will also use other standard scientific manuals. And the Richmond Vale Academy Nursery, whether it will be in Richmond or a bit further south in North Leeward, will be visited by at least 800 people. Many of these are students, as Indigo Dive has a glass-bottom boat. So it includes renting this boat and taking students out to see the nursery and teach about the importance of the corals and how can we actually improve the reefs by growing and how those corals actually work, because it's a fascinating world. A coral is an animal, which took myself a little bit of time to get around. So there's a lot we can learn about the nature that will help us take better care of it.
The training is expected to commence in the next 3 months, as Herberg noted the impact of the volcanic eruption on the work of the Academy. However, she is confident that they will recover in time to commence the training, noting that the Coral Reef Restoration Project will also be taking place in the neighboring St. Lucia.
Now, coral reefs is very, very important. So they provide very many ecosystem services to tourism, fisheries, and coastal protection. And protecting our corals is critical for food security and how we get ready for climate change, as corals as a buffer to storm surges. Now, in this project, there is going to be 3 new coral nurseries. That will be one in Union Island with sustainable grenadines, one in Miro, and then one in North Leeward. We will get back to the exact location because of the volcanic eruption in Richmond, so it might be further south than planned. Actually, this project has a very big goal. It has a goal to propagate and outplant 10,000 elkhorn corals and 30,000 staghorn corals. So that is about 40 hectares of reefs that will be improved in these areas between St. Lucia and actually south to PSV. Now,
Herberg also highlighted why it is very important to take care of the coral reefs in SVG.
Coral reefs are under threat. Agrochemicals, the chemical farming, and runoff pollution from hotels and other households and businesses. This is a big threat for the reefs. So more than 50% of the reefs in the Caribbean have already been lost. And with warmer temperatures due to the current climate emergency that we are in the middle of, warmer temperature also is in the water is damaging for the coral reefs. And so it's very crucial to protect the coral reefs. It's some of the most biodiverse ecosystems on the planet. And I would love to see forward, as we are hopefully getting back to have some tourism, more tourism going, that the ecotourism will increase in St. Vincent, and that conservation, that actually we could see St. Vincent in the future as an ecotourism and eco-conservation capital in the Caribbean. And I think that will actually attract a lot of tourists to come here. Yeah.
Currently, environmental groups in SVG and other concerned citizens are lobbying against an application made to remove the coral reefs from Indian Bay.